Welcome to In the Loop, the podcast where we consider some of the significant challenges facing our health and care system. I'm Neil Dickson, former broadcaster and health leader, and my co-pilot is also a former NHS chair, as well as being a prolific and controversial commentator, Roy Lilley. Hello, Roy.
Hello, Neil. Hi.
Today our guest is the economist Sir Andrew Dilnot, one-time director of the Institute for Fiscal Studies. Andrew is also being Principal of St Hugh's College and Warden of Nuffield College, Oxford, as well as Chair of the UK Statistics Authority. In 2011, he chaired the Commission on Funding of Care and Support, and its eponymous report has the dubious distinction of being one of those much-admired documents whose key recommendations have never seen the light of day. The Dilnot Review did not suggest free care for all like the NHS, means testing would be continued for older adults, but it did recommend that an individual's lifetime contributions towards their social care costs should be capped. It also suggested that the means tested threshold, above which people pay their full care costs, should be increased. And it said younger adults needing care and support should be eligible for free state support for all their lives. At the time, Andrew said funding for adult social care had been ignored for too long and that the system was, wait for it, confusing, unfair and unsustainable. Now his report has ended up alongside a long bookshelf of weighty tomes filled with undelivered reform. Tony Blair's Royal Commission of 1999 was rejected as too expensive. The Wanless report I commissioned at the King's Fund hit the buffers with the 2008 financial crash. The Barker report in 2014, regarded as too expensive by the coalition government, and numerous successor reports from Parliament and think tanks. And when reform was proposed at various points, the Tories called Labour plans a death tax, and Labour called the Conservative plans a dementia tax. And then in 2019, Boris Johnson stood outside Downing Street and promised to fix the crisis once and for all. Now, a new Labour government has arrived with more promises and, wait for it, has set up yet another review, which will report in 2028. Talk about kicking into the long grass. And the Health Select Committee has now challenged ministers to take into account the cost of inaction. So, Roy, let's see if we can unravel this Gordian knot with Andrew, remembering there's no money tree, and unlike the promised Social Care Commission, the Defence Review is about to appear very soon with a very hefty price tag for our hard-up Chancellor Rachel Reeves. But first, Roy, what's your take on this latest Select Committee report?
Well, Neil, I thought it was a really good report. Bear in mind, of course, that the Select Committees they're supposed to be neutral, but they're not really. They are sort of politically weighted. And there's no question about it. It is very critical of this government and previous governments, really. But you can't look at social care without being critical of previous governments. But the thing that struck me, the most important thing, was the point they made over the cost of inaction, the cost of, as you very succinctly put it, kicking it into the long grass, the cost of all these reports that never have turned into anything. And the cost of that is going up all the time. And on the day that we are recording this, it's the day that Keir Starmer stood up in number 10 in the press room there and announced his new How to Stop Refugee programme. And of course, there's a chunk of it in there. And if people are interested in looking at it, it's page 27. There's only 3 paragraphs worth looking at if you're interested in social care. And it doesn't help at all. It makes really no concession to the contribution that people make who come from other countries and work in a system where let's face it, if there's a modern equivalent of slave labour in the UK, it must be for people who are working in social care, doing the most difficult and personal and intimate work with people for like tuppence wages, really. And there's nothing in this. They're going to actually stop more people coming. People who are here already working in the sector are safe, but it stops, or it will stop, more people following in their footsteps, and it's going to make everything a lot more difficult. So, we are absolutely, despite the government's report this morning on refugees and migration, and despite what I thought was surprisingly a very good Select Committee report, we are no further forward.
It's very difficult to see how we get out of this now because they've actually shut one of the doors which allowed social care to operate in some manner or form. And the idea that you're going to somehow convert these large numbers of young people who are all going to pile into social care, and the point being made is, oh, well, it doesn't take that long to train them. It's not necessarily about the training, it's the mindset and everything else. The idea that there are going to be all these people who are going to come in and do the job. And the answer is if people are not going to do the job, then we'll be in an even bigger crisis than we are now.
I couldn't agree more. And I actually, this morning, I had a look at the costs of all this. And if, just for example, you said, OK, well, we will recognise that these are really poor level wages and we will up the wages that people are earning in adult social care. And let's say, for example, we gave them a 20% increase like the government gave the junior doctors who were on strike for more money. They gave them 20%. And I calculated this morning, I mean, it is, I've got to admit, it's on the back of a fact packet and, you know, it's not, you know, like, don't take it as gospel, but I'm sure I'm in the right territory. It's about a 6 billion cost to adding to the 1.5 million people who are working in social care. There's no way that the sector can support a 1.5 million uplift. Where we go, I honestly don't know it. I mean, well, the only thing we can do, we know we have to bite the bullet and put wages up, make it a proper career structure, train people properly, make some kind of a qualification, certification, all of that. We know what to do, but we don't know where the money's going to come from. And we know really where it's going to come from. It's going to come from you and from me and everybody listening to this. We will have to pay for it. Now, the Dilnot report, which we can discuss with the great man himself in a few minutes, I mean, it does make some sensible suggestions. And let's see if he stands by those suggestions still after all these years.
I should say, incidentally, Roy, before we start, that we are focused on England throughout our conversation. I think it's also fair to say that other parts of the UK are not necessarily beacons of hope, with problems in funding, workforce, unmet need, quality of care, and integration with health, all still major headaches there as well. But now let's welcome Andrew Dilnot. Andrew, very warm welcome. I wonder if I could just start by asking you, why do you think it is that social care has been a quagmire for government after government? We don't seem to have been able to tackle it.
I don't really know. At least I can't think of a good explanation, because honestly, we really should. It's, I think, one of the big public policy problems that hasn't been addressed that really could transform the lives of millions of people who need care, their families, the people providing the care, all of us. So I don't fully understand. There are a few possible reasons. One is I think we don't really like thinking about it. We particularly don't like thinking about our extreme old age and our anxiety about that. Old age is something that still frightens us a little bit, and it shouldn't. If you ask many people receiving social care in old age about how happy they are, their self-reported life satisfaction is better than many of us. The second is that I think if you've been a family that's had somebody needing social care, by the time you're through the process, which is pretty grueling, you're often so exhausted that you just haven't got the energy to become a campaigner. So although people go through terrible things and can see that things need to be changed, I think they're too tired. The third reason is the power of the Treasury. The Treasury doesn't want to do something on social care because it will cost some money, not huge amounts of money. I'm sure we'll talk about how much later, but the Treasury's job almost is to push back. And to get something through, you've got to have a Prime Minister in particular who really wants to get something done. So I think if we're to get something done over the next 3 or 4 years, Keir Starmer's the person that we have to look to.
And on that Keir Starmer point, Boris Johnson did promise that he would do something with it, but did you take him seriously?
So honestly, when I first heard, I thought, well, I wonder if they've got a sensible plan. It turned out their plan was to have a plan, but they were very happy to talk to us. And he then did get some legislation on the books. The second time legislation based on what we'd said way back in 2011 was legislated for. And I found myself in the funny position of, funny in the sense that most people in the UK seem to want Boris Johnson to stop being Prime Minister. I could see that if he continued to be Prime Minister for 2 months longer than he actually was, then that legislation and the changes that were enshrined in it would have been beyond the point of no return. They would have happened. As it was, he stopped being Prime Minister first. Liz Truss's government abolished the health and social care levy that was to pay for it, and then Rishi Sunak postponed for 2 years, and then the Labour government postponed in perpetuity the changes. So Boris Johnson did care about it, and had he continued as Prime Minister, ironically, we would have had some reforms.
Do you know, I've just finished reading Johnson's memoirs. May the good Lord forgive me, but there is no doubt about it. I got the sense he really did want to sort that out. And I remember when he was the Mayor of London, he showed a real interest in healthcare. But I absolutely do get the sense that he wanted to do something, but he ran out of time. And of course, doing something is the really difficult thing, isn't it? And you say it's the money. I mean, we're recording this on the day that Keir Starmer made his new announcements on how he's going to settle migration. But what is interesting is that on page 27, as I've been reading it, there are only 3 paragraphs on adult social care. And you can see from the way it's written and for the sort of dismissive couple of paragraphs, this is nowhere near on the top of Starmer's list of things to do. It has no priority at all. It's a damn nuisance as far as migration is concerned, because of, you know, all the reasons that we've had people coming over here to work in our system and we can't do without them now. And they've got to somehow try and close this down. All the time Nigel Farage is running the policy for the Labour Party. It's not going to change. But you can see, you know, here is the Labour Party, for heaven's sake, just totally dismissive of the predicament that we've got ourselves into with social care.
And we should be delighting in all of this. We've got more people needing social care. Why is that? Because we live so much longer. Back at the beginning of the last century, hardly any really old people. 61,000 people in the 1901 census aged over 80 or 85. That number by 2011 was 1.447 million. And we're expecting it to be 3 million by 2030. Well, that's fantastic. Here we are. None of us is terribly young. I'm very excited by the prospect that I'm quite likely to be alive when I'm 70 and 75 and 80 and 85 and even 90. I may not be, but there's a good probability. That has transformed the world. It's fantastic that we live so much longer. It's a really wonderful triumph of the last 150 years. And by the way, there's a side effect, a consequence, that we need to make sure that people are looked after if they need care at the end of their lives. It's a simple, straightforward thing. It's the one big risk that the British welfare state created in 1948 hasn't addressed, and governments should grow up and get on with it. And if they don't, they're not going to be able to resolve the challenges of the NHS. That's not why we should do social care. We should do social care because that way we can give people better lives. We can pool a risk that is unpooled. But if we don't, then we're not going to be able to sort out the NHS.
Is it true the baby boomers come through and then the big demand bubble for elder care tails off a bit? I think we're kind of approaching the period where the worst is over in terms of numbers. Is that right?
Well, the rate at which the numbers grow will tail off, but the numbers are not going to fall.
No.
Not significantly, because the driver of this is not just that there are a lot of people born in the 50s and 60s, there were, but that they're living longer. Once we get past mid-1960s, birth rates have declined. Death rates have not gone up again. We've gone on with people living longer and longer. So we're going to be in a world where, thank goodness, grandchildren and even great-grandchildren are going to know their grandparents, but they're going to need care.
Roy's message about where the current government may be at and the signal that they're sending to social care about staff must be a cause of real concern. How do you react to their Casey review, the idea of doing a review but saying that it'll eventually report in 2028? Does that make you pessimistic about the degree of commitment that this Prime Minister and this government has towards the issue?
So I was pretty cross in July when, having on the record deliberately promised that they would go ahead with the introduction of reforms in October 2025 during the election campaign. On the record, explicitly, the person who is now the Secretary of State for Health and Social Care said, we're going to go ahead with this. This is the confidence and certainty that I want to give to the population. And then 3 weeks or so after the election, they changed their minds. I was cross at that time, and I thought that was poor behaviour. That having happened, one of the things about economists is we just look forward. You've just got to look forward. That's the only thing that's, once that had happened, there had to be some possible catalyst for action. And If you were going to have a catalyst for action, Louise Casey is probably about as good a catalyst as you could get. She's a no-nonsense kind of a person with a record of saying things as she sees them and getting things done. So the fact that it's Louise Casey who they've asked to take this on, I think, is positive. There's one very negative thing about it, which is the timescale they've suggested, which is that they want a final report after 3 years. Well, that seems to me crazy. Of course, there are things that will take at least 3 years to work on, but the direction of travel can be identified much more quickly than that. So I hope, and honestly rather expect, that Louise Casey, in her interim report after a year, will be able to set out what the change needs to be. Then, of course, there's lots of detailed work to be done. It's worth saying, though, that you've got to sort out the funding. Funding is the prerequisite to everything. There are many things that are at least as important as funding, but we can't work them out until we know what the funding structure will be. So what I really hope is that Louise Casey will bring her famously no-nonsense approach to all of this and say, this is what we're going to do, and here are the next bits of work that need to be done.
And you know, what surprised me about the Casey review is the fact that they're actually asking her to come up with a cross-party agreement on the future of social care. They've kind of subcontracted the politics of it to a civil servant. She's not a civil servant anymore, but I mean, I'm not in any way, downgrading her. She's a very tough lady and done some great stuff for both parties. So she's probably a good choice. But it just struck me as odd that in her sort of list of things to do was to trail around all the other parties and say, well, do you agree with this? That's not her job, in my view. And her view is to say, this is the situation. These are like 3 ways of solving it. Over to you, to the politics. Does it strike you as odd?
It does seem a bit odd, and I think you're right that what's needed here is political leadership and political courage. We know what the options are. You could make it completely free, treat it like the NHS. That's got quite a large price tag to it. I don't expect that to be what anybody recommends, but you could do that. You could go for the kind of proposal that the commission I was involved with recommended, that's received the royal assent twice and has been in the manifestos of all 3 of the main English parties in most of the elections since 2015. Or you could do something different. You could, for example, go for a version of the Scottish model. I don't think that's at all a sensible thing to do, but you could do that. But all of the options are out there. What we need is some political guts and clarity of what was going to be done. And in terms of cross-party support, of course, as I say, it's been the policy of all 3 of the main English parties for the last more than 10 years. So we've kind of got the cross-party support on what should be done. What we haven't had cross-party consensus on is where the money should come from. And I think that's really what they want Louise Casey to go away and arrange an agreement on. Whether that can be done, I don't know. I think given the scale of the majority that the Labour Party have got at the moment, and I think almost certainty the Liberal Democrats, as long as the proposal is broadly sensible, will support it, they should just get on with it.
One of the things that certainly has upset some people within both health and social care was the Secretary of State saying, well, social care is completely different from healthcare. It needs to be treated in a different way. Whereas I think a lot of people who are actually receiving social care would say, I don't differentiate between those needs. These are needs to enable me to live as independent a life as possible. And one may be labelled medical and the other social. And actually, increasingly, I'd like the same people to be able to deliver all those services.
I mean, it just seems very puzzling to the average woman or man on the Clapham omnibus. Why do we treat somebody whose health and social care needs are the result of pancreatic cancer or heart failure differently to someone whose needs are the result of dementia? Is there any possible rigorous differentiation we can make there? Not really. The split that we have at the moment is just an accident of history. That in 1948, we left social care in the hands of the local authorities and left it means tested at a time when we created a healthcare system that was universal, comprehensive and free. At least that was its aim. I don't think there is a coherent way of defending the difference between those two. And so saying that these are radically different, they are radically different, but they're radically different in practice, not in principle. We're just in a muddle about it. All of this makes me think there's one more point that we should make, and forgive me if you think this is too blunt. One of the things that we've already talked about is why something doesn't happen. One of the reasons, I think, is that there are aspects of social care that we just really don't like to think about, and the most obvious of those is incontinence. So incontinence is a common feature of particularly further down the social care journey. When double incontinence kicks in, that's often the point at which informal care just becomes very hard. We don't talk about that. We have a whole debate about this. We almost never talk about incontinence.
Yeah.
But if you go and talk with families who are in the midst of all of this, that can often be one of the really big presenting issues. Well, again, we should all grow up. I don't want just to blame the politicians. We all have to accept responsibility here. Politicians, for example, often say they don't get much in their post bags about social care. We all need to talk about this more. We all need to recognise it. 80% of us are going to need social care in our old age. And behaving as though it's not there is just not a very sensible way of carrying on.
It's interesting. We talk about no action since 2011, but of course, a lot has happened in 2011. The level of need has increased, the number of people who are not getting. And you were complaining at that time about a massive shortage, as did even the King's Fund report before that. And now the level of need that you require to demonstrate in order to get help is even greater, with massive consequences for the healthcare system.
Do you know, I came across some numbers just recently. I've been working off numbers that I got from the British Red Cross, actually. And I was talking to them and I learned that because local authorities, the only way they can get out of their financial bind is to raise the eligibility criteria. And most of them have pushed it up to the top. And that meant at that time there were 900 million elderly people who used to get care who no longer get care. And that was a figure that I used.
I think you must have meant 900,000.
Sorry, yes, forgive me, yes, 900,000. And thank you for correcting me. And I used that figure for quite a long time. But I discovered just recently that Age UK and the government have used this figure as well, that the figure is now 2 million. 2 million people who, because of increases in eligibility criteria, no longer get the care they need. Is it any wonder they end up in A&E and are stuck on a ward and can't get home because no one can find a care package?
To use a technical term, the whole thing is a bit bonkers. And many hospitals have got between 15 and 30% of their beds occupied by people who would much rather not be in them, would be much better cared for not in them, but cared for in social care, would be more cheaply cared for in social care. And then those beds could be used for what they're meant to be used for, which is relatively short care, elective procedures coming in and out. It is madness. We're not going to sort the healthcare system out until we resolve social care. And as you both said, we've got fewer people receiving support and care from the state, paid for by the state now, than we had in 2011. And essentially every year, the Treasury comes along and announces an emergency increase in funding for social care. So if you're announcing an emergency every year, then you need to look yourself in the mirror, because it can't be a surprise if it's happening every year. And of course, giving extra money during the year means that the money is not spent very effectively by local authorities who didn't know it was coming. I told it they've got to spend it, and they've got to spend it that year, so they don't spend it efficiently. And again, it's just not very mature government to be pretending that sticking another sticking plaster on, when you stuck a sticking plaster on every year for the last 10 years, is going to make it better. It's not. You'd have as much chance of kissing it, making it better. For goodness sake, face up to it and come up with a sensible funding plan for the long run that will allow people to do things sensibly.
Might the fact that the health service is much clearer now about the damage that this is having on its own operation be a cause for government and the rest of us, as you say, to start taking this more seriously and do something about it? I remember Hancock during the pandemic for one day wore a little badge saying social care, and then he forgot about it again. And there is that tendency to focus everything on the health service. But if you ask people in the health service, in the acute sector, the hospital sector, they'd say the one thing you guys need to sort out is community care in the wider sense and social care in particular.
That's absolutely right, that practitioners within the healthcare system can see the damage that is being done, but there is a tendency for politicians to see it from the other end of the telescope. And I'm afraid I've sat in the Secretary of State for Health and Social Care's office on at least 2 occasions with different secretaries of state saying that they're aware that they should have put pressure on the Treasury to come up with a sensible funding settlement for social care, but that they've made the judgment that if they'd done that, they wouldn't have got as much as they wanted for the NHS. And so they've apologised for having made that judgment, and it has been the wrong call.
I've been in and around the NHS for over 50 years. I've seen 23 reorganisations. This is my 23rd reorganisations with ICBs. And I did think that an ICB, Integrated Care Board, where everybody could kind of get round the table together, would have provided us with the beginnings, if not the solution, the beginnings of a solution. But we got 40 odd of them, too many. They're likely to end up as about 20. And so they're in chaos and they're not looking really which way they're going. They're just trying to survive the day. And now I hear whispers from Whitehall that the plan might be to do away with them altogether and reintroduce 10 regions and have the link between Whitehall and what happens at the coalface through region. And so that's yet another upheaval. And my question really is it really necessary for social care to become part of healthcare? Could not two efficient, well-funded organisations work together, or is it really impossible?
So I don't think it's impossible. I think it's challenging. I've always been sceptical, not of the idea that integration is a good idea, it's clearly a good idea, but of the idea that it would be the magic bullet. And that's partly because we've had integration in Northern Ireland since the early 1970s. And many of the same challenges that we face in England are also faced in Northern Ireland. So integration doesn't do it on its own. If we were starting from scratch, if we were back in 1948 and we had a crystal ball that would have shown us 2025, we wouldn't have separated the two activities. I'm absolutely confident of that. We simply wouldn't have done.
If we know what we know now, we
would have delivered them in a single system. But
but
honestly, given where we are now, I don't think it's realistic to imagine a government having the energy, strength and funding to nationalise social care. Nationalising social care would mean an increase in spending of the order of 30 to 35 billion pounds a year. That's not completely inconceivable. Economically, it's perfectly feasible. Politically, I simply don't think it is. So I think we have to find a way of making the two systems work together.
But that's Labour policy, Andrew, isn't it? They're now saying they want a national care service, and there's a 10-year
They're saying
rollout.
they want a national care service, but they're not actually saying what they mean by a national care service. And the one thing that is absolutely clear is they don't mean the same as the National Health Service. Universal,
Absolutely.
comprehensive and free. That's not what they mean.
Integrated care boards have the word integrated before them, but they're not. They're health service organisations. Some of them do much better than others in terms of trying to push that integration. I looked through the recent document that they did about the future of ICBs. Integrated care boards, think that first word. The word social care is not mentioned at all, not from beginning, middle or end. So that does worry me. I agree, obviously, bringing them together, moving them from local authorities, maybe that is a step too far. I absolutely agree it's not a panacea, but in some ways, some greater integration, even beyond some of the financial stuff that's around at the moment, I think is a prerequisite if you're going to get effective care. And you will increasingly, or we should increasingly, surely, see people who are providing health and social care, not one or the other. And the way in which we use innovation and the way in which we keep people supported independently in their own homes should be something that is joint, not separate.
Now, I completely agree with all of that. But let me run through what I think is the real problem with the funding arrangements for social care at the moment. Almost all of us are going to need social care. The trouble is we don't know how much it's going to be. And for some of us, it will be nothing. We'll be walking up Ben Nevis at the age of 93, fully fit and healthy, heart attack, gone, never need any social care. Most of us will need social care. The person in the middle of need might need 6 or 9 months of care in their own home, 3 to 5 months in residential care. But some of us are going to need 10 years or more in a residential care facility. If you're a couple and you both do, you could be talking about £1.5 to £2 million of expenditure. And that's something that people simply can't manage. The current system effectively says to us, save up enough just in case you're the person with the greatest need. Now, most people can't save that much. That means most people are absolutely terrified. Needing social care is like being in a shop with no prices. So you know how many how much it's going to cost per week or per month for your husband or wife or grandma or to be looked after. But because you don't know how long it's going on for, you don't know what the price is. And that means that with the exception of a tiny number of extremely wealthy people, everybody else is trying to spend the least they possibly can. And that means that the sharp elbows of the middle classes are not really engaged in this. And the wonder of the market is not really engaged with this. So unless we're going to nationalise the whole thing, which would be economically feasible, but I think politically is not feasible, we have to find a way of making the market work. And we have to find a way of freeing people from the terror that they face at the moment. And that's why our recommendation was, you don't have to nationalise the whole lot, but you have to nationalise the extreme risk. So you have to set a level beyond which, if you're one of the unlucky ones who has that much care need, the state will pay. Pool the risk, do social insurance, and that way we can make it work.
That's the solution, isn't it? That's the answer that you came up with God knows how long ago when you first wrote your report. Well, that gives you an insurable risk, doesn't it? You can do that. I mean, very few people, I think, are going to take out an insurance against that. But what you could do, you could say, OK, you can take money out of your pension fund to pay for your elder care or what have you. Once you've got that threshold, it strikes me that the rest is tempted to say the rest is easy. I mean, it's not easy, but I mean, it gives you a lot of clarity. So, I mean, there are solutions there to do.
There are solutions, as they've been legislated for twice. The version of it that Boris Johnson legislated for, which I didn't like very much, it was a bit meaner than I would have liked in a whole number of dimensions, but it was a massive step forward from where we are now. The long run cost of that was going to be £3.5 billion a year, compared to total public spending last year of 1,279.3 billion, and an economy now getting close to £3,000 billion a year. So about 1/10% of the national economy to transform the experience of the end of the lives of most of us and the families of all of us as we go through it, but also critically to transform the experience of the providers of care. Because while the system doesn't work very well, the people providing the care, this 1.5 million wonderful people who look after us at a time of our great need with affection and preserving our dignity, we can do something to make their lives better. As an example of a kind of tragic failure of the democratic process, the failure to do something about this is something that I'm embarrassed by, I'm ashamed of. I feel I failed to make the case clearly enough to get it done, but we should all be embarrassed, and the politicians above all. You know, if the role of politicians and politics is to identify the things that we need to do together because the market left to itself won't do it properly, this has to be at the top of the list. And my hunch is that a great deal of political credit will go to the government that finally gets this done.
Even though, of course, interestingly, they're talking about a cross-party consensus as the means by which they go forward, and therefore, in a sense, they should not or would not get all the credit for it. Do you think, if you look back on pensions, where there was cross-party support, and I don't think that actually got the government of the day much credit, but it did provide real solutions going forward, maybe that's where we're going to now.
Andrew, thank you so much. The right thing to do, and that's what governments are for. That's a great way, I think, for us to end our conversation today. We're enormously grateful to you. Thank you so much for giving us your time and being such an interesting guest. Sir Andrew Dilnot, thank you very much.
I don't know about your reaction, Roy. Andrew is always so insightful, and it is a tragedy that somebody like that has been putting pressure on government over all these years and yet has not succeeded. And even now, although we might think Louise Casey will produce something, there has to be real concern about the level of political commitment to really bring this about.
You know, as you say, I mean, he speaks with huge clarity. He's got all the numbers at his fingertips. And of course, if you were in government, you'd want to listen to him, wouldn't you? Why wouldn't you want to listen to him? Why do we need, bless her, good luck to her, but why do we need Louise Casey to tell us all what we know she's going to? I mean, there is only one thing you can do: create an insurable risk. I come back to the point that I made right at the start. We were recording this on a day when the Prime Minister is announcing his migration policy. And it's pretty clear, because of the interconnection between migration policy and workers in this sector and the way that they've kicked this into the long grass, this government has no interest in solving this. And I have to say, neither does any other. It's just too difficult. And there are no votes in it. It's a horrible thing to say. But, you know, when your granny passes on, you get the company in to clear the house, and you look at the photographs of the funeral flowers, and the distant memory gets washed away in tears, and you all move on. Life moves on. There are no votes in this, and it's because social care is an orphan service.
I agree absolutely about the insurable risk. I do think the other side is providing integrated service. I'm not advocating a particular model for that, but unless we start providing integrated services which get rid of the sclerosis which is affecting the health service. And the one optimistic thing about that is perhaps government will listen and politicians will listen to the health service pleading that you've got to solve this problem, because our problems will never be solved until you solve the social care problem. And that message has come through in recent years, but it has to come through even louder going forward if the impetus is going to be taken forward. And if Louise Casey, who I have enormous respect for, if she's going to be able to produce something which political parties take forward. And let us hope that long before 2028, we're able to say the social care thing has been solved.
Let's hope so. Thanks for listening, everyone. And we look forward to next time. I think we've got Sir Jeremy Hunt next time.
We do indeed. And he might have some questions about social care to answer as well.
We'll make sure he does. Goodbye now.
Goodbye.